So hi everybody, welcome to the second event for the Queer Health Education Series. Today we're focusing on queer youth and my name is Jordan Sanchez. My pronouns are they, she. I'm a healthcare enrollment coordinator for Bradbury-Sullivan LGBTQ Community Center in Allentown, but I'm a satellite employee. I work in Pittsburgh and I work with organizations across Western Pennsylvania.
My name is Owen Pudliner. I use he, him pronouns. I am also a healthcare enrollment coordinator, and I am based out of the physical location of Bradbury-Sullivan LGBT Community Center here in Allentown, and I serve the Eastern PA region if you were to exclude Philadelphia, and I'll pass it on.
My name is David Shelley, and I am the Philadelphia Healthcare Enrollment Coordinator. My pronouns are he, him. I serve the greater Philadelphia area. All right, so with that, I wanted to introduce our special guest for tonight. This is Jai, Deputy Director at galaei, which is a queer and trans Black, Indigenous, people of color, radical social justice organization. galaei fights for access, opportunity, sexual empowerment, and economic justice while fighting against systematic oppression, structural racism, discrimination, and white supremacy. So I will hand it off to Jai to introduce themselves.
Sure. Hello, everyone. I'm going to assume people are saying hi back. I feel the love. Did you all want to keep the background up? So
I have a, oh, do you have something you want to share on it?
No, this is fine.
Oh, okay. I was gonna put the Padlet up
Sure.
to start with like that.
See people in space.
Yeah. Okay, so
Okay.
the way, oh, you can see all my screen. Yeah. So the way we are hoping to do this event is just keep it casual, have a casual conversation about a very important topic. We wanted to move away from like the formality, the lecture style thing, you know, and have it more intimate since this is a very important conversation. So we're going to start with a reflective question here with this Padlet. Has anybody used Padlet before? And if you have or haven't, that's totally fine. It's like an whatchamacallit? Like a virtual
like
clipboard.
A
the what?
Is it like a Kahoot?
Kind of, but there's not like that game feel. So it's just kind of like a virtual bulletin board. So
Okay.
we had a couple questions we wanted to pose to the audience just to, you know,
Sure.
get the grinds gearing. First question, two-parter. Where did you learn about health and what were the topics? Second question, who introduced you to taking care of yourself? As you can see on the screen here, this is the Padlet screen. To the bottom right hand corner, there's a plus sign. Press that, a box will come up. You can type your answers. You can do one-worded answers. You can do a sentence. You can even insert like a picture or a GIF, whatever you are comfortable with. Totally optional. If you don't want to use a Padlet, feel free to unmute yourself. Feel free to just write in the chat box. First one, where did you learn about health and what were the topics? Planned Parenthood, learned about birth control, contraception, abortion care, pap smears, etc. Love that. Planned Parenthood's a good resource. I frequent there a lot because I did not understand how to go to the doctors or make like a doctor appointment in like a bigger facility. Second one, who introduced you to taking care of you? Honestly, work. I learned so much of what I know after pursuing a career in sexual and reproductive health. Wow. Yeah, I feel that. Before taking this position, I worked in higher education, very different dynamics. So I learned a lot about the education system, whatever goes beyond there. Not too much about health. So it wasn't until I got into this position that I really started thinking about health in a different way, thinking about it. And here's my cat. More than just like you know, I got to make a doctor appointment and that's that.
I think a lot about health on so many levels, right? Where'd you learn to go to the bathroom? How did you learn about your genitalia? Where did you learn about your teeth, your oral health, all of these things? And for me personally, I feel privileged and experienced to have had parents in a family dynamic that taught me, but reality is, though, that's not true for so many people within our communities, be it Black and non-Black, right? How often, and honestly, I can streamline that and say, even though I grew up in a single parent household, I know that I could have gone to my biological mother to say, like, what's a penis? How do you use it? Reality is, I think her answers would have been limited. I think that she would have definitely been like, it's this thing that does this. But the questions that I would have wanted to know about my body, the changes I've been feeling, and then being someone that's non-binary and not knowing at such a young age is so important, right? Because we're thinking about expression and my identity and how I'm oozing into wanting to mold into myself. My healthcare is impacted by that, right? My sexual reproductive health and the things that I need to be telling the doctors, right? When I started to experience sexual activities, when I began to explore sexuality, period, I think that it was important to have a doctor to say, what are STIs and all those things. And unfortunately, but fortunately, I mean, I'm not ashamed. I began having sex as early as the age of 11. And with that, I should have been able to go to someone and say, what is happening to my body? My body is expanding, you know, I'm perceiving myself in these ways. Am I at risk of these things? What is harm reduction? What are condoms? How to put it, you know, those kind of things. So, and then quite frankly, I don't want to leave it at this, but quite frankly, the marginalization of queer people color, and then Black people, is that sometimes we learn the bulk of the information that we learn directly in our living rooms if we are privileged. We learn through pathology. We learn through hearsay, right? We see that grandma, grandpa might be experiencing hypertension, but as so many people have noted, I learned this at work, but how old were you when you got a job, right? And I do think it's fair, you know, in this conversation to suggest that sometimes it's not always, and it's contingent on the family. Sometimes we don't always learn about healthcare and taking care of our mind, body, and souls as early as we learn our ABCs. And I would like to see that shift. That's a real interesting shift. You're taught the health component, right? But what we are not taught is the things we need to know. What is a CD4, right? What are viral loads? Can you get HIV from butt sex, right? Like, what even is that? Like, at what age? And if you're lesbian, like, what's the Netherlands? What is that? What area? Like, those conversations, what we are not talking about is sex. We're not just saying, you know, we want to be sexual beings and all we want to do is screw. We're saying, if I want to explore this aspect of living, how can I do it safely? And what do I need to know? And I think a pamphlet is not enough. I think I have no clue about that because I don't do that. It's not enough. And then also servicing someone who's interested in these things with psychotherapy as a first level, right? Because, you know, they thought we were crazy as queer people, all shade. Marketing it as a psychosis is also not helpful. I think what we deserve to know is what the hell is happening with our bodies, not the fear of STIs, but if you have an STI, it's treatable.
Right.
And here are the medications. Here's the information. And that is just simply destigmatizing these things so that sexual beings can exist, but exist in, do I want to say a healthy way? I want to take the non-judgmental language out, but in a way that benefits everyone, I think is what I want to say. But back to you, Jordan.
No, yeah. No, you're totally right. It's just, I feel like it's so much like these are the consequences, but there's no discussion of like, this is, you know, the situations that it might arrive in. This is what you should know. This is like how it should feel to you. You know, are you feeling good about
Right.
what you're doing with your body, etc.? Are you with the good partners? There's a lot to it, and it's just hyper focused on like, just don't do it because these are the risk. And so if you just abstain from all of that, you know, you won't get sick, you won't get pregnant, you won't, you know, end up in like this worse situation that they make it out to be, when, like you said, a lot of stuff is treatable, a lot of stuff should be destigmatized, because that
Mhm.
is like, we all have some type of relationship with health. But if we are just honing in on the negativity and just like further marginalizing people that go through this,
Mhm.
it's just, you know, we're not getting anywhere. We're not making anybody like healthier.
And I can say, if I would have known, if I would have seen, have been exposed to certain things in my personal life, irrespective of the letters I have behind my name and my successes, I think, I know on every day that I would be so much further in life. My body would be healthier. My mind would be healthier. I would have, for the love of God, I would have been non-binary, right? Because I would have known how to define myself. I would have been able to name myself. And I didn't learn that until I got into my 30s. And that is sad.
Wow.
That is a very sad story, that I didn't know how to give myself mental permission and physical permission to live in my skin. Every doctor I went to, you know, I was looking at myself and I'm touching myself, like, what's going on? And they're like, oh, you're regular. You're built like a man. You're just a man. And I'm like, right, that doesn't feel good coming out of your mouth. So I need support. And then my family's pathology, right? I am supposed to be this one thing per the people who bore me. That doesn't feel good. And 30 some odd years later, I'm speaking to you all, and I feel better than I've ever been. But it took time. And I would like for queer youth to know and to feel moving forward that it can happen as early as 10, 7, 8, however early. And and maybe you can speak more to that, that idea of when you get to live in your freaking skin and how good it feels to just, and do we want to call that a privilege, or do we want to call that, and we can have that, that's a separate conversation, I feel, but you can speak more to that possibly, Owen.
Sure. Like, I think about this a lot, and not having the knowledge just of how to relate to another person, because I just wasn't around other queer people, that's, you know, transgender folks, that's, you know, any of us. So I just did not have that sort of something outside myself that I could relate to, which would have been very useful. And you know, my mother did her best. She was a single parent, and, you know, I'll always love her for being my mom, but she wasn't a very proactive parent in the way of, you know, making sure that not just my survival level basic needs were met. There were definitely a lot lacking beyond that. I think, you know, to relate to you a little bit there, Jay, like, we're just so many years feel like they were wasted before you could fully understand and embrace yourself. For so long, for literal decades, I was in survival mode and far from thriving. And it wasn't until that I had my current partner, you know, prompted this in me, and just being able to, they saw it in me and allowed me like that space to see it in myself as well. And it wasn't until that moment, and, you know, going through all the initial stuff that, you know, that I had to go through to transition and fully realize myself. It was a lot, and there was a lot of pain with it, in a lot of ways, but I wouldn't change anything about making all those huge emotional jumps to do it, because now I actually like care about myself.
Right, yeah.
Yeah.
And if I can affirm you, Owen, That is amazing and wonderful and powerful. And I hope you do that every day of your life. That is
Thanks,
wonderful.
Jay. Thank you.
Absolutely.
Jay, can I ask you a follow-up question?
Sure.
Okay, so you said the term pathology and familial pathology a couple times since we've been chatting. Can you define that? And then like,
Sure.
of course, like discuss like the connection to queer youth and queer health?
Familial pathology can look a number of ways, but really what it is what your family passes down to you. It could be the psychology of the, I'm sorry, I'm gonna admit this person, the health disparities of, it could be a number of things. So for example, I know my mother lives with hypertension, right? And so you go to the doctors, you get a workup, and a lot of times they inform us when we go to the doctors that there's a likelihood that we have to go through your genealogy in order to identify what may or may not be true for you. And so my story is that because my mother lives with hypertension, I do too, right? Now, on a mental note, right? Unfortunately, my father is someone who deals with severe mental illness. Now, I've been fortunate that I do not, right? But I also do not, because I did not allow that pathology to start with me. I stopped it and I chose to break the pattern of self-hate and self-harm and the cyclical pattern of kind of blaming others for things that truly it's nobody's fault, right? Being born into a single parent household is not the worst thing in the world and does not have to determine my entire narrative as a human being. Not taking care of myself as it relates to queer youth and health. So there's this thing, so simple. All of this is so simple in a way, and I don't mean to diminish anything, but the sentence popped into my head of, I don't know. I didn't know how to. No one ever told me. And then I think about the curiosity that we aren't allowed to hone, in that my tummy aches, pain, do something about it, right? We're told, as people, to just shove it in and do this and do that, and not go to the doctors, not investigate, not go to the library, because in some way, shape, or form, these things are accessible to us to act in the least. Okay, my finger's broken. What can I do? What resources are made available to me? And oftentimes in a lot of communities, specifically the queer community, they do seek these resources out. And it is folks who are not a part of the queer and young community that are saying, well, money is a thing. You cannot do this thing. And if you do, we'll bill you thousands and thousands and thousands and thousands of dollars. And that is an extremely unfortunate disadvantage that queer youth as early as the age of 16 experience working at McDonald's or trying to even better themselves or wanting to look into college, for example. I know for me, it wasn't something to fear, but now our youth are thinking, more ahead, like, okay, if I go to school, I will accrue this thing called debt, whatever that is, however they were told to wrap their minds around it, and be 50 years old, hundreds of thousands of dollars in debt, unable to afford what? Health insurance. And it's all somehow intersected in a very disgusting way. And it is familial, because then you find yourself like your mama, like your daddy, like these people's, falling in line, if you will. And in order to not be in line, sometimes you have to be, for lack of better words, crazy enough to jump in the deep end. Iconic, or Owen, I'm going to use you, Owen enough to say, you know what? Today is the day. This is the moment that whatever I'm feeling in me, I'm going to take care of it. I'm going to investigate it. I'm going to advocate for myself. And these things don't come easy, right? Sometimes you need someone to hold your hand, or you have to permit yourself to permit someone else to advocate for you and with you, to investigate in your healthcare, to if you're a sex worker, for example, to go to that appointment every 3 months, to find a doctor that is willing to listen to your behaviors, right? Because I can say for me, when I went to my doctor, I might have been 20. My doctor said, oh no, you're homosexual, you have to go somewhere else. Wherever else, I don't know, but you have to go somewhere else to receive regular primary care, just regular primary care. I knew absolutely nothing, and I could have been at risk. And I can honestly say, life could have happened to me a number of times, and it did not. And that is a very big, deep breath for me. So, does that answer your question, Jordan?
Yeah, I think so. When I was listening to the term, I was like, okay, I'm thinking like genetics. I'm thinking of like, you know, what kind of health issues may run in your family. Like I have people in my family that are, you know, bipolar, that are drug addicts, that are a lot of things, right? I love them because they're my family, but that's what I was thinking too. But then I was also thinking like, okay, so then does that include like different behaviors and like
it could
thoughts? Okay, that are modeled to us.
It doesn't have to. It could, but it does not have to. But one of the bigger points here is we're not taught to pay attention, to even investigate. That's the point. So I know for me, I found myself frustrated and angry and trying to figure things out in college. And I thought to investigate that a little bit deeper. Is there something going on? Like, why am I sometimes on go? Am I dealing with something that is outside of myself? And I found out I have anxiety. And so does my grandmother, right? But then I also have asthma, like my mother. So it became a, is there anything else I need to know so that I don't get older? And then like my aunties, like, you know, other people, they die. We have so many ancestors and family members that have just died. And the narrative is, it just came out of nowhere. It just happened. But things don't just happen.
Right.
So that idea of things lying dormant is possible and also bullshit. But very possible. I'm not a scientist.
Yeah, that gave me a lot to think about. Thank you for clarifying it. I was like trying to Google it. I was like, you know, I'll just ask you directly.
No, it's that thing where, you know, and I'll use the HIV terminology. In HIV work, we tell people, you know, get tested because HIV can lie dormant in your system for 10 years, right? We've been saying that for years. And then it became get tested every 3 months because you never know. It could be dormant, but then in the same vein, your behaviors change. So it's become more about the behaviors and less about the actual, what is the word that starts with the C? It's leaving me. The actual act of sex, if you will. Which is a good thing. You know, we're trying to get there as social workers and people who work in HIV, but the point is taking a look at the behaviors and ensuring that we're giving people the adequate education that they deserve is far better than telling them to do something out of fear. And actually giving what we know opposed to, well, here's a wall that I ran into. How come no one told me? We deserve to disseminate that. Or dismantle that. That's what I meant to say. Dismantle, not disseminate.
So this kind of goes back to like how we were first discussing sexual health, especially as like sex ed for youth. So I guess, what was my follow-up question? Oh no, don't say it. Just, oh no.
Can I interject?
Please do.
Okay. No, but that was like beautiful, Jay. Like, and like that hit so many notes with me because it immediately made me think of how going to the doctors and learning about my mental health, like mental health did not impact me until I turned 20 years old. And that was a shocker for me because like you feel fine as a child almost. And at some point you're like, I'm not okay. What is going on? And I started to realize all these things built up through my childhood and my teen years had just destroyed me internally, and I was bottling it up, and I let it create all this stuff inside me and give me depression, anxiety, and everything. And now it's taking me till 25 to be able to really unravel that. And I absolutely hated that question when they would ask me, the doctors, oh, does it run in your family? What does your mother, your father, your aunt, and it really made me feel uncomfortable, because in the sense of like, oh my gosh, I don't know. And then it goes to, why don't we discuss these things? Like, am I not close with my family? Is it just me? Or no, it's the society that we live in, and the fact that I'm queer. And they, once they found out I was queer at 17, they really didn't give me like the birds and the bees sex talk. Like
Right.
they kind of stopped at the puberty thing once they found out I was queer, because they didn't know how to navigate that. And I don't blame them for that, because they aren't queer, but they could have really researched it and taught me it. But it's hard to blame your parents, because
I feel you're trying to say
yeah,
something. I want to
yeah,
support you.
yeah. It's like I want to support them, but I have to also kind of like point the
Go
finger and
on.
say, like, you could have done better as parents. You could have done better as parents and really supported me there. Yeah, and even to this day, you can see I'm still struggling with that. Like, it's it's adapting, growing, and learning as you get older. And that really struck me, because that question bugged me so much when they asked that, because it makes me feel like I don't know my family. And I learned out before my grandmother died, the day after my birthday in February, that she had anxiety her entire life, and she was on anxiety medication like me. And I felt so much more connected and familiar to her. And no wonder I understood her so much, because we were both anxious all the time. And it makes so much sense. And we acted the same way. And now I understand. I'm like, wait, maybe I should calm down, take it slow, react, like relax and react to life day by day, and not think so far ahead. And I'm thankful that I got that moment.
And consider what the relationship and relationships in your family and in our families period could be if we do have these conversations more. If we as change makers say, you know, to our children, to our youth, to our cousins, like if we see something in them and we know they're dealing with something. I've never said this, but who cares? I live with epilepsy. And I have not seen since I was 16, but if I had a kid, my child was dealing with something, I would absolutely, positively not hide that. I absolutely would want that person to know, you know what? This thing is a lot, and it could feel like a lot at times, but what it isn't is something that has to control your life. It does not have to be something that you have to be ashamed of, because I was taught shame before I was taught empowerment. No one told me that this thing would not control me. I was so sure that I would be in hospitals and laid up in beds. I didn't think that I would go to a prom. I didn't think a lot. And yes, David, I'm going to say it because of my damn family. Because they did the work and the research, but what they did not do is what I really needed. I needed that hug and that it'll be okay times 25, because there's a heavy depressive state that comes along with this thing that you're learning at 9 years old. Like, what the hell? And so it's not a problem to say, you know, Mom, you did good. Because I mean, they pushed us out. They're amazing people. And also, though, I really, really needed to know what sex was, even though I'm queer. I needed to know what could happen to my body because I'm still a person. I needed to know our family genetics, because now I'm 25 and I'm experiencing some things, and it's frustrating to find that grandmom did or uncle did. Like, that could be very frustrating, and you don't deserve it. But also, we deserve better as queer people, queer youth, queer people of color. We don't deserve the bare minimum, and this is what we've been served. Period. Unfortunately. Ain't that what the kids say? Period, Pooh.
You know, it took my mom a while to realize, like, that I could be kind of discriminated against as a queer person. And it wasn't until I was going to the hospital for my mental health one time when I was low, and she had taken me, and one of the nurses there was not enough beds in the hospital. I was in the hallway. So take it, I was in a very public area as well. I wasn't in like a private room or anything. The nurse had said, I was crying. I was a mess. I was not in a good mental state. And she said, if my son was acting like this, I would tell him to stop acting like a girl. And that like made me like crack. Like I just started to sob more. Like, and as someone who's there for like on a mental health crisis, for her to say that like was just awful. And my mom was like 15 feet away. And I think for the first time she had realized like that was like a very inappropriate comment for the moment. And my mom had pulled her aside and said something to her in the hallway and was like, that was so inappropriate. Like, why would you say something like that? Like, you're like insulting, like, you are a female, like, you are insulting, even like saying that females like should be ashamed for being sensitive. Like, males can be sensitive too, as well. Like, it's ridiculous. Like, yeah.
Thank you for that. That's beautiful. And shout out to your mom for standing up. That's wonderful.
Yeah, she's an OG.
I love it.
So I guess that's a good segue into like the third question that we have up on the Padlet is like what can adults with power, so whether it's like parents, healthcare professionals, teachers, you know, whoever's an adult with power that is working close with kids, is like, what can they do to improve like the learning of health and healthcare for queer youth?
What would you say to your younger self? How would you converse? And it could be a sentence, it could be a word, it could be, but what would you say to you about your health, your sexual reproductive health, to inform who you are now?
I think I would tell myself to use my mom's health insurance sooner and start getting into therapy sooner so that I can work against the awful thing that shame is. It's an awful thing. And that's truly like it's truly all I can think of. And I think it would, yeah, health insurance, it's great. Yeah, that's all I got.
Believe in yourself. Like, don't like second guess any of your thoughts or opinions or anything that you want to do, even if it comes from the closest people to you. That's not always true, and sometimes things will change years later and you'll realize, oh, everything's fine. But yeah, not that thing of not always believing what everyone closest says to you is true.
Last couple things I wanted to share. We're having our last queer health education event April 1st, so 2 weeks from today. And we will be speaking with Dane Menken, who is a trans medical provider. And we'll just be, you know, kind of something like this, right? Where we're dipping our toes into the conversation so we can, you know, be better advocates, be better supporters. Last thing is the LGBTQ health needs assessment that various organizations like Bradbury-Sullivan is hosting. So this is a survey that is trying to get a better understanding of the needs and the health standing of the queer and trans community here in Pennsylvania. So the tiny URL link is the registration link for Trans Health event. The second link is the direct link to the health needs assessment. There's a version in English and there's a version in Espanol. So deadline for the health needs assessment closes on Monday. So fill it out, share it with your friends. Yeah, feel free to drop your email, any contact information you'd like to share in the chat box so we can keep this conversation going. I want to thank everyone for being here, especially on a Friday night when the weather is working up and you're here on Zoom with us. Thank you. That's amazing. Jay, thank you so much. Any last words?
Yeah, permit yourself to do, permit yourself to think, and permit yourself to be. If It is all things good and all things positive. Absolutely, positively give yourself permission to do it. And if you mess up, that is okay. You can always start over and over and over and over. Love yourself. And if you can't love yourself, who the hell else? Come on. Hallelujah. I love every last one of you, and I thank you all for having me today. And I hope you all enjoy the weekend to the best of your ability.